Hello everyone, welcome to my channel. Today we are going to discuss about clinical anatomy of brachial plexus. In clinical anatomy of brachial plexus, we have three clinical conditions, that is Erb's paralysis, Klumpkin paralysis and Horner's syndrome. First, we will detailedly discuss about each Erb's paralysis, Klumpkin paralysis and Horner's syndrome, how they cause, what are the site of injury and what are the deformities, what is the disability and what are the nerves involved, what are the muscles get paralyzed. So, first we will discuss about Erb's paralysis. Erb's paralysis is caused due to if the upper trunk of brachial plexus is called Erb's point. You can see here where the six nerves meet, it is called Erb's point. If these upper trunk of brachial plexus, which is called Erb's point, is get injured at this point where the six nerves meet, then this Erb's paralysis occur. You should remember the upper trunk of brachial plexus. It is called Erb's point where the six nerves meet. If this get injured, it leads to Erb's paralysis. You can see the hand how it looks like. It causes undue separation of hand from the shoulder, which is commonly encountered in birth injury or difficult childbirth, fallen shoulder or during anesthesia. In these conditions it causes. Next, the nerve roots involved in this Erb's paralysis are mainly C5 and partially C6. Both nerves involved, but more C5 is involved than the C6. Next, some of the muscles get paralyzed, that are biceps brachii, deltoid brachialis, brachioradialis. These are mainly paralyzed muscles, and some nerves are partially paralyzed, that are supraspinatus, infraspinatus and supinator muscles. You can see these nerve roots C5 and C6. Next, muscles are supraspinatus, infraspinatus, supinator. These are partially involved, and biceps brachii, deltoid, brachioradialis and brachialis muscles are mainly involved in this Erb's paralysis. You can see here Erb's point where the six nerves meet. It is called Erb's point. If this site get injury, it leads to Erb's paralysis. Next, deformity and position of the limb. Arm hangs by side and it is abducted and medially rotated. Next, forearm is extended and pronated. You can I am giving my notes also. If you have any doubts, you can check in my notes also. See here, I mentioned site of injury, upper trunk of brachial plexus and where Erb's point where six nerves meet. Next, causes birth injury, difficult childbirth, fall on shoulder during anesthesia. Nerve roots involved are mainly C5 and partially C6. These are site of injury, cause of injury and nerve roots involved. Next, muscles paralyzed. As I told earlier, biceps brachii, deltoid brachialis, brachioradialis. These are mainly and partially supraspinatus, infraspinatus and supinator muscles. Next, we will discuss about deformity and position of limb. Deformities: arms hang by side and abducted and medially rotated. Forearm extended and pronated. It is also known as policeman tip hands, waiter's tip hand and porter's tip hand. This is main important and it is also asked in Viva or also in MCQs. Policeman tip hand, waiter's tip hand and porter's tip hand. Next, disabilities: abduction and lateral rotation of arm at the shoulder joint and flexion and supination of forearm. These are the next, biceps and supinator jerks are also lost. Abduction and lateral rotation of arm at shoulder joint, flexion and supination of forearm, biceps and supinator jerks. These are the movements which are lost in Erb's paralysis. You can clearly see in the diagram where is the Erb's point. It is very important for Viva and exam. Next, we will discuss these policeman tip hand, waiter's tip hand and porter's tip hand. You can see in the diagram, first I shows one baby's diagram, no? How the hand looks like, somewhat backwards and it is like bended. It is called policeman tip hands, waiter's tip hand or porter's tip hand. Next, we will discuss about Klumpkin's paralysis. In Erb's paralysis, If the injury occurs to upper trunk, it leads to Erb's paralysis. Whereas in Klumpkin paralysis, if the injury occurs to lower trunk of brachial plexus, you should remember lower trunk of brachial plexus, it causes abduction of arm, as in clenching something, means catching something with the hands after a fall from the height, or sometimes in the birth injury. See how the hand looks like. It is called a claw hand, Klumpkin paralysis. Next, nerve roots involved in these are mainly T1 and partially C8, whereas in Erb's paralysis mainly C5, partially C6. In Klumpkin paralysis mainly T1 and partially C8. Muscles paralyzed in Klumpkin paralysis are intrinsic muscles of hand, that is T1, and ulnar flexors of the wrist and fingers, C8 muscles. These are get paralyzed in Klumpkin paralysis. Klumpkin paralysis, site of injury lower trunk, cause of injury abduction of arm, nerve root involved T1 and C8, muscles intrinsic muscles, flexors of wrist. Next, deformity and position of hand. Claw hand, complete claw hand, it is caused due to unopposed action of long flexors and extensors of fingers. Next, in claw hand, there is hyperextension at metacarpopharyngeal joints and flexion at interphalangeal joints. You should remember this. In claw hand, there is hyperextension at metacarpopharyngeal joints and flexion at interphalangeal joints. Next, disability. Complete claw hand, cutaneous anesthesia, vasomotor changes and tropic changes. You can see the claw hand, how it looks like. There is hyperextension at metacarpopharyngeal joints and flexion at interphalangeal joints. This is claw hand, how it looks like. You can see in diagram clearly. Wasting of forearm muscles, claw hand bending downwards and fingers are somewhat towards closed. This is claw hand. The major difference between the Erb's paralysis and Klumpkin paralysis is, in Erb's paralysis, site of injury is upper trunk. In Klumpkin paralysis, site of injury is lower trunk. And Erb's paralysis, it is called policeman strip hand, waiter strip hand, or porter strip hand. Klumpkin paralysis, it is called claw hand. You can see claw hand, how it looks, and you can see policeman tips hand or waiter strip hand in the first baby's diagram. Next, we will discuss one more clinical condition. It is called Horner's syndromes. After this, Erb's paralysis and Klumpkin paralysis. Klumpkin paralysis, claw hand, mainly T1 and C8. Next, Horner's syndrome. This is caused if the T1 is injured proximally to the white ramus communicans of first thoracic sympathetic ganglion. This is because of injury to sympathetic fibers to the head and neck that leaves the spinal cord nerve through T1. It causes ptosis, meiosis and handrhysosis and enphthalmosis. This is Horner's syndrome. You can see in the diagram. We have completed Erb's paralysis, Klumpkin paralysis and Horner's syndrome. If you have any doubts, please let me know in the comment box. Like, share and subscribe my channel so that I can post more videos and I can clarify your doubts and I can explain more topics. Thank you. Please like, share and subscribe my channel.